Across the country, people have been putting off regular doctor's appointments because of the coronavirus. That's an issue for children's wellness visits because it means in a lot of cases their vaccinations are being delayed. Numbers from the CDC show vaccination rates have fallen by as much as 40% in some places. As Mitch Legan reports, doctors are hoping to catch kids up before flu season starts in the fall.
Abby Bone had enough on her plate, trying to balance her job as an attorney with her role as a new mother. Then a global pandemic hit.
Parenting in general is hard just because every step is just constant, paranoia. But then when you throw in this pandemic, especially with all the unknowns, it's super scary.
Now she has a decision to make. Her son Teddy's vaccination schedule has him set to go to the doctors next week for shots. But with everything surrounding COVID-19, she's not sure if it's a good idea.
I think every day and week we're learning things about the pandemic, and so if next week things start to clear up and we see a significant downfall, and then maybe. But right now I don't think there are a ton of things that's worth the risk for me.
Since the coronavirus pandemic hit the U.S., parents across the state and country have found themselves in the same situation as Bone. According to the Centers for Disease Control and Prevention, vaccine orders plummeted after President Donald Trump declared a national emergency on March 13th.
In general, across the country, many of the vaccines have gone down by 50 to 70%. So I don't know that we have exact numbers for our Bloomington area practices right now, but we certainly know that we have vaccinated fewer kids.
In 2019, Monroe County had a vaccination rate of about 83%, which put it near the top of the state. So what could be keeping parents from the pediatrician's office?
I think people are scared and they're trying to navigate again, sort of keeping their families safe, and they may not see preventive behaviors as the most important thing to focus on when we're facing a global pandemic.
In Indiana, the numbers show a similar story. In the month of April alone, the number of non-flu vaccinations ordered for children 18 and under fell by more than 93,000 doses, nearly a 47% decrease compared to last April. The State Department of Health is still evaluating data from January to May of this year, but those in healthcare say those numbers are only now starting to creep back up.
I mean, hopefully we're in a position right now where we can get people caught up and keep our high vaccination coverage so that we can not worry so much about these highly communicable illnesses.
That's a concern for health professionals throughout Indiana, which already ranks near the bottom of the country in vaccination rates.
We really would be heartbroken to lose children over vaccine preventable diseases in the middle of a pandemic. So we're really focusing on that right now. We're working with the Indiana Immunization Coalition, and as I mentioned, our local health departments that also give a large bulk of our immunizations.
The good news is that for children younger than 2 like Teddy, drops in vaccinations haven't been as steep since health providers have been prioritizing them. But the challenge for providers now is convincing those parents that the risks of skipping vaccinations for things like diphtheria and whooping cough outweigh the possibility of contracting COVID-19.
I think a lot of parents in particular are delaying those well-child visits or delaying vaccines because they're trying to keep their family safe. And I think what we would say is that this is another really important way to keep them safe.
In an attempt to ease concerns, the Greene County Hospital Foundation has separated its rural health clinics so that those who are feeling healthy get sent to the blue clinics, like the one in Bloomfield. People with respiratory symptoms get sent to the yellow clinic in Linton, while those with COVID-19 are sent to the general hospital there.
Before we let anybody come into the blue clinic, they're screened for COVID symptoms, and there are some other questions we ask just to keep sick patients separate from well patients.
Everyone at the Greene County clinics is required to wear masks, and only one parent is allowed in the building with their child. Plus, Head says many pediatricians' offices are purposefully separated from the rest of a hospital, meaning parents won't necessarily be walking into an ER or an ICU.
It is a scary time, and it's important to acknowledge that there's uncertainty around sort of everything happening right now. But there is not uncertainty around the safety and effectiveness of the vaccines that we have.
And in addition to vaccines' public health importance, skipping appointments could impact how schools reopen. Having a crop of kids who aren't up to date on their shots would make planning the upcoming school year even more difficult than it already has been. Dr. Moore says now he and pediatricians across the state are focused on tracking down the kids whose vaccinations have been delayed and getting them back into the office in preparation for whatever this fall brings. For Indiana Newsdesk, I'm Mitch Legan.